Hi, my name is Dr. Samar Nahas. I'm a gynecologist and minimally invasive surgeon. I work at UCR Health. Oncology is a very unique, specific field in women's health and gynecology in general. It requires additional board certificate and training, and it provides services to the community and patients that could not be provided by general gynecology. Oncology will include evaluation and management for different kinds of gynecological cancer, like endometrial cancer or uterine cancer, ovarian cancer, fallopian tube cancer, peritoneal carcinomatosis, vulvar cancer, vaginal cancer, and cervical cancer. So you can see the scope is really broad, and we have the treatment and the evaluation that is needed for all our patients. We also collaborate with a lot of our physicians in the community that could offer a multidisciplinary approach for additional treatment if needed to those patients to provide the patient with the complete comprehensive care they need. For gynecological malignancies, because it's variety of organs and variety of topics, the symptoms could vary significantly. For endometrial cancer or uterine cancer, most patients will have either abnormal vaginal discharge or abnormal uterine bleeding or postmenopausal bleeding. The difference is abnormal uterine bleeding is they're still within their premenopausal age, but postmenopausal bleeding is any bleeding after 12 months of stopping their last period. Some patients think that having a bleeding coming back is just normal. They're having bleeding back, but it's absolutely not normal. They have to be evaluated and managed to rule out cancer. Not all postmenopausal bleedings or abnormal uterine bleedings is a diagnosis of cancer, but you definitely have to have the proper workup, including imaging, including a biopsy, to be able to determine if you have the condition or not. Other examples of symptoms you could have is postcoital bleeding or bleeding after intercourse or abnormal pap smears if the patient hadn't had or had an abnormal pap smear. Those symptoms trigger an evaluation by a gynecologist, examining the cervix, looking at the cervix, and then if the patient hadn't had a pap smear, they need to do a pap smear plus minus a biopsy, sometime a colposcopy. Based on the results of those, we determine the next step of the patient's management.